What's good, everybody? It's Ahmed. Thank you for listening to the Ahmed's Voice podcast. Now, over the years, a lot of people have asked me, how do you get into podcasting? It's not that difficult, but check this out. Anchor makes it even easier. If you haven't heard about Anchor, it is the easiest way to make a podcast. I'll let you know what's up. First of all, it's completely free. I got you right there, right? They have creation tools that allow you to record and edit your podcast right from your phone or your computer. Anchor will even distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and a whole lot of other platforms. You can even make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Download the free Anchor app or go to anchor.fm to get started. Hey, what's going on? Ahmed Dance here. Welcome to the all-new Ahmed's Voice podcast, episode number 1. If you listen to my past podcast, the More Than a Voice podcast, thank you for coming back to join me for this brand new venture. Then those sounds you hear underneath me, that is my man, Mr. Patrick Yandel. The name of the track, Darker the Grape. You can find it on his latest release entitled Jazz on the Vine. A big shout out and thank you to Patrick for allowing me to use Darker the Grape for the theme music for the Ahmed's Voice podcast. And if you want to check out a great conversation with Patrick, head on over to ahmedsvoice.com. You can check out old episodes of the More Than a Voice podcast and check out a great conversation and learn more about Patrick. Make sure you visit Patrick's website at patrickyandel.com. The man is an amazing musician. This is the all-new Ahmed's Voice podcast, and this time around it is broadcasting, or recording, I should say, live from Brew Bar, 277 3rd Avenue in Chula Vista. My man Alex McDaniel has opened the door for us to record every Monday night in the Brew Bar, and it's going to be a great venture, so thank you, Alex. Make sure you visit Brew Bar. Cocktails, coffee, delicious food. Of course, like everything else, it's only open to outdoor dining right now and pickup. Again, 277 3rd Avenue in Chula Vista, California. Make sure you get out there, check out Brew Bar and my man Alex. This is the Ahmed's Voice podcast on Anchor Podcast, also soon to be on Spotify. It might be on Spotify right now. Also Google Podcasts and Apple Podcasts. Sometimes it takes a little time for the feeds to filter through, but you'll be able to listen to the podcast on your favorite platform in which you listen to podcasts and music. Episode number 1, this is the Ahmed's Voice podcast, and my very special guest for this episode is Samantha Gambles Farr. She is the president of the San Diego Black Nurses Association, and the primary subject of the conversation this time around, of course, is about COVID-19. Samantha has all the information for you, infection rates, numbers, death numbers, recovery numbers, the ins and outs of things with treatment of COVID, why it's important for us to follow guidelines, and just the real deal, even the real deal about fears when it comes to vaccines. Is the vaccine schedule too soon? What are the fears of people of color when it comes to taking vaccines, when it comes to the history of medical exploitation in the United States? We also take a minute as Alex joins the conversation to talk about COVID-19 in regards to business and how it affects his customers and his employees and his overall business. It is a great episode. Go ahead, dive in, take a listen, and visit ahmedsvoice.com. If you're just listening to this podcast, there'll be a page for this podcast to where I'll have links to all of the websites and information that Samantha talks about. And we had a great conversation. Dig in, check it out. This is episode number 1 of the Ahmed's Voice podcast, live from the Brew Bar, featuring Samantha Gambles Farr. Check. 1, 2, we good? Good to go.
Check.
Okay.
Can you hear me?
What's up, everybody? It is Ahmed. I'm back with the Ahmed's Voice podcast, episode number 1. My guest today is Samantha Gambles Farr, president of the San Diego Black Nurses Association. We are going to be talking about getting the real deal about COVID. And the thing about the podcast this time around, I'm going to be coming live and direct every time from Brew Bar in Chula Vista. My man Alex has opened the door to record the podcast, so y'all need to get down here to Brew Bar, 277 3rd Avenue in Chula Vista. Alex is always whipping up something delicious up in here. Every time I've been in here, I've been like, yeah, dude, we got to get you a cooking show. We're gonna have to do a video podcast of just what goes down in here. That's what we're gonna do, man. But our boy Eric hooked me and Alex up, man. I think this is gonna be a partnership made in heaven, and so you guys need to get down here to Brew Bar and check Alex out. You got anything you want to say, Alex? You want anything you want to tell the folks?
No, I'm just really excited to be a part of the conversation. Things that are being talked about are important, and the reason Brew Bar exists is because I felt like most of the new kind of coffee shops and stuff that were coming out, people were spending more time on their devices and spending more time separating from one another and worrying about details in the drinks. And so that's why I don't even call this place a coffee shop or a wine bar or anything. I just call it a lounge where people can come back and remember what good, honest conversation is about. So to be a part of this with you is a real honor. Thank you. Cool.
Thank you, man. Thank you. Let's go ahead and get into it. So y'all know where we at right now in society. We're things are crazy. I even talking to my dad, who's just is approaching his 90s, just celebrated his birthday. This is a crazy time for him, and he's seen everything. And this is a crazy time in America. Whenever I talk to him, he's like, look, man, I don't know what to tell you, son. And so, we know what's going on. Well, we think we know what's going on with COVID. We have so much information coming from so many different places. Everybody on social media is an epidemiologist or a doctor or a disease specialist, you know what I mean? And the media is not helping, especially the mainstream media, the big media companies. They're not helping because they have a lot of agendas they need to fill. So it's really hard to get the right information and really know what's going on. And so I asked Samantha to come back. A lot of y'all are familiar with her from the More Than a Voice podcast. We had a great conversation then, but Samantha's back to really give us the real deal on what's going on with COVID and literally how real is it. It's while we were setting up for this podcast, I get a call from my brother telling me that he has COVID and his family, back in the East Coast. So, that's how real it is. We're looking at which is a whole nother podcast, but we're looking at an economic situation where everything is shut down behind this, and that's leading to either other health problems and mental health problems on top of everything that's going on now. So, but the main focus we're going to do in this podcast is let Samantha tell us. I have some questions, but I'm really going to let Samantha guide this and tell us what she thinks we need to know, as far as where we're at right now, because I just think we need to have real information. And everybody's online on Facebook and Twitter, like, listen to the experts. Okay, I went and got one. I went and got someone who knows what they're talking about. So I don't want to hear none of y'all say nothing to me from this point forward. But thank you for coming back, Samantha. I appreciate it.
Thank you. It's a pleasure to be here. I'm so happy to be back. I kind of missed you a little bit. I'm glad to be back. The last show that we had was the podcast that we did last time was such a breath of fresh air. I was so happy to be there and just to discuss, San Diego Black nurses and then just the general welfare and health of the community, but particularly the African American community. So I'm glad to be back because this is a very unique time that we're living in. We haven't had a pandemic in so many years, and I would hope that we have learned from our mistakes, but I feel like because a lot of us weren't there, we weren't living through it, we definitely did not learn from some of our mistakes,
right.
As it relates to community and things like that. So I'm glad to be back to talk about COVID-19 or coronavirus 19. So
good. And like I said, it's I'm glad you're here to talk because, like I said, there's so much every day that comes at you by way of social media, by way of whatever news outlet you listen to, by by way of whatever study comes from this place or whatever's, it doesn't help that, throughout this whole time from the beginning, the CDC released something 1 week, 2 weeks later it's different, 3 weeks later it's after that, it's different. And so people begin to lose their focus or they begin to lose faith on what's true. So I just wanted to get the information from you.
I think
where do you want to start? Yeah,
I think one of the things too. I'd like to start with that.
Yeah.
It's a pandemic.
Yeah.
And when we have pandemics and we have a disease that is new, you have to investigate it. And so as you investigate, you come up with the scientific method is hypothesis. Mm-hmm. So you start with hypothesis and you do the research for it, and either it turns out to be true or not. And then based upon that, then you make recommendations. Coronavirus is no different. I mean, COVID-19 is no different than any other virus or any other disease process that has been studied since the beginning of time.
Right.
So every disease that we've ever had, even when you think about HIV and AIDS, how originally that started and what we thought HIV/AIDS was, mm-hmm. and then how it progressed into something different, and we ended up coming and becoming more educated with how it transmits and all everything that has to do with that. And so I think that COVID-19 is no different than that. I think what is particularly alarming, or perhaps alarming to people, is that we have a better idea of how it's transmitted, but with HIV and AIDS, we had a specific way that we thought it was transmitted, mm-hmm. that one way, and then it turned out it was not only through sexual contact, but it was also through blood and blood transfusion. So we didn't know that second component, but we definitely knew that first component. We knew somewhat about COVID-19 because of what happened overseas in China and then what happened in Europe. So we had some bases because they were already ahead of us. So the things that we knew when COVID-19 hit America was because we were behind the other countries that had already experienced it. So when you saw what happened in Europe, they essentially shut down for many months. Right. Nobody was allowed to go anywhere. Like, they shut down the entire country. There were some, of course, in America, depending on where you live and depending on what city you're in, depending on what state you're in, there was a large variance as far as how it was treated with regards to shutdown, regulations, restrictions, and things like that. And I think that that's an important thing for people to remember when we're kind of beginning this process of talking about COVID-19, is that when you're dealing with something that you don't know, you have to investigate it to become educated about it.
Right.
And so I think that that's an important point to think about when we're talking about this subject.
Right. Because I've had to slow myself down, only because I think what lends to that is because once everything shut down and things started going kind of crazy, there's a lot of stress involved. Mm-hmm. And when you're confronted with something you don't know, Americans like to think they know everything. We don't like to not be in control. We don't like to not be in control of information. And then we also like to think we know something that everybody else doesn't. You know what I mean? And so, like you said, in this time, we've never been faced with a pandemic like this on this scale. And so, everything just went haywire, and everybody's jumping to conclusions, or they don't want to face the reality of not knowing, which is real difficult to face the reality of something you just don't know. You don't know what the outcome is going to be. And so therefore you try to do things to take control. And it was politicized from the start. And we are already a very fragmented and polarized country. So Completely. This is just another thing that came and was just able to just split people, just fracture communities and everything.
Well, I think the other thing is that, when you're thinking about this, fear. Mm-hmm. That's the number one. All the things that you just said the root of that is fear. Fear of not being in control, fear of not knowing what's going to happen, fear of not really understanding how long this is going to last. Mm-hmm. There's a large component of fear, which is what you saw manufactured in mm-hmm. people buying all the toilet paper, people were afraid. And so in thinking about how to translate that, people started doing things that they wouldn't normally do, and protecting and insulating themselves. And so I think that fear is the root cause to all the things that you were saying just now. Nobody wants to be in a situation where they don't know where their next check is coming from, especially for people who have suffered economically as a result of COVID-19, which is a large population of Americans. People who had plans for their life, and then you have to deal with people who've gotten sick, and then you have to deal with their family members. And how do you deal with that? I mean, even going to visit someone, or even going to do things like seeing grandparents in convalescent homes or SNFs or any of those things, all that stuff has changed. And so there's a real fear component as it relates. And then, as you said, we are so compartmentalized, and there's so many things that COVID has been utilized to almost separate us when we should be coming together as a community, no matter what size community you come from, whether it's your family community, your city community, your state community, and as a nation, as a community, we should be working together when it relates to health and health-related issues. It is not a political stance that you have to take to care about the health and welfare of someone else by doing a simple act.
Right.
That not only protects them, but protects you as well.
Yeah. I know a lot of people were kind of like foreign to the idea of, you know, a lot of things that came along with this, but like, you know, before this came along, like, you know, my mom and dad, they're in their 80s. I have an aunt at home that's in her 70s. And we already took those precautions of like, you know, whenever the kids were sick, you know, it was like, okay, you can't go see grandma and granddad right now. Like, they're too advanced. There's too many health issues. Like, a lot of people already lived in that realm of thinking that way, but as this evolved, I saw that there were so many people that just had no idea. Like, you know, I grew up, my mom's allergic to shellfish. We grew up with having to wash the hands and doing everything before we, you know, my dad has been diabetic. He's a cancer survivor. You know, we already had that in mind of having to take care of ourselves and take care of them. If we're ill, we can't see them. And so we already had that mindset, as a lot of people do, because a lot of people do have elderly parents and they have to go down that road and learn how to do that. But, you know, we see a majority of the country doesn't. And I want you to get into what you want to talk about, but I do want to ask you the seriousness of the thing that is a ridiculous thing that's dividing this country right now, but the mask situation, because it seems like this is the most ridiculous thing almost going on that's like dividing the country, that people are almost literally up in arms about in stores and in public. Like, people literally marched on state capitals about wearing a piece of cloth over their mouth. You know what I mean? Can you just briefly, like, as we just start and get into this, can we just tell people why it's important to wear a mask?
So, when you don't know and you're not used to something, the initial reaction is, I don't want to do it. It's not important. It's not important to me. With relation to the mask, you know, this is a disease process that has transmission through droplet, which means like particles that come out of your mouth, and then airborne, which means once it hits the air, it can travel. And then we decided, or what has been recommended, or what has been researched and studied, is that they believe us standing 6 feet apart, and then even when you're talking, you release particles because spit is in your mouth, and that's just how it works. And so the best way to protect someone is to isolate and remove that barrier or that transmission mode, which is to cover your face with either a mask or a bandana or anything like that. So I don't quite understand why there is such a large withdrawal or inability for a population or a specific amount of people to not want to wear their mask. I think a lot of it has to do with how we were already established in this country before this healthcare crisis happens. I think it has a lot to do with, quite frankly, the messaging that has been coming from, I think attitude reflects leadership. I think that's the best way for me to say this. And if the leaders are not doing what is recommended by the epidemiologists, by people who have spent their entire lives dedicated to health, research, epidemiology, infectious disease. If you are unwilling to listen to that person, then essentially what you're saying is that you just don't believe what they're saying.
Right.
And you just don't trust them and you don't believe them. And I think a lot of that has to do with people taking a stance on politics. I'm not saying all, but perhaps some, and a large population of them. Also, even dealing with large gatherings. We know that particularly churches, they've not been able to congregate, And so there's these important things in people's lives that they really hone into, and that's really an integral part of who they are. And when you're not able to do those things, you retract and you repel. And so that's where not wearing the mask comes into place. For me, we call that standard precautions in a hospital. I work in a hospital setting. So when you have surgery, your surgeon, the nurses, the anesthesiologist, everybody wears masks. You have to wear a type of scrub into the operating room. You have to wear a head mat, like hair coverings, maybe even shoe coverings. And that is to protect you. That is to protect the patient from contracting, hair falling into their surgical bed or into their wound. And I know that that's a lot different than what we're talking about. But at the same time, it's really not that foreign of a concept, because when you're in a provider's office, when you're in the hospital, the commonality in when we're treating you is that we protect you and we protect ourselves by putting on gloves, by washing our hands. Those are things that have to happen. And this is no different than that. I mean, the same precautions that we are asking people to do, wash your hands, social distancing is social and physical distancing. I like to call it physical distancing, are no different. And so I don't really have an answer to that, because my mind doesn't think like that. My mind is just thinking, why would you not do something that could potentially protect you, and it doesn't harm you? It doesn't create any harm for you. There's no pain associated with it. I really have a hard time answering that question.
It seemed like it became somehow it became a mantra of people's freedom being restricted.
Yes.
And people took it really seriously, overboard serious, like overboard serious. It's okay, maybe it's inconvenient because you've gone most of your life not having to walk out the house with a mask on, but you know what? You go into the store, you get out your car, you put your mask on, you go in the store, you get back in the car, you take your mask off, and you go home.
Hopefully you've used hand sanitizer and washed your hands.
You've done all that.
Don't forget all that.
Yeah, you've done all that. But I think, somewhere along the line just became this thing of you're restricting my freedom and you're trying to impose something upon me. And it's come on, dude, there's a lot of other stuff that are imposed upon you every day that you're not tripping on, but whatever.
Until it really becomes in a hospital setting, even in an outpatient setting. I have many colleagues, members of San Diego Black nurses that work, or anybody who's a nurse or a provider, whether they're an MD, a PA, or a nurse practitioner, or a nurse anesthetist, or anybody who works in healthcare, from the CNA to anybody who works and takes care of people. We all have to don the protection, because we have to go home to our families after taking care of you.
Right.
And so, that's where I have, in the very beginning, there were people who hadn't seen their families in a month because they didn't know what this was. They didn't know how it was transmitted, but all they knew is that they didn't want to take it home to their family members. And so I think that we have to respect each other's pain and anguish when it comes to dealing with things as it relates to this particular pandemic, because it's hard for me to, and this is just me personally, it's hard for me personally to really understand how someone can be so upset about wearing a mask when I wear two masks, a face shield, a head covering, And when we're dealing with certain trauma patients, we have to put on lead and a gown cover and shoe covers. And if someone's in duress, I don't know if you've ever had to do CPR with all that garb on, but that is taxing. Mm-hmm. Putting on a mask to go into a grocery store, that is not taxing.
Right.
It's not taxing in any way, shape, or form.
Right. What let's get into it, because I know you had a lot of stuff that you wanted to bring to the table, and I really wanted you to guide this conversation, because again, I wanted you to be able to talk about this in the way that it needed to be talked about. Like, there's a lot of stuff we have. I people come on the podcast, I know a lot about. I don't know nothing about all this. Like, but I wanted to provide a forum for you to come on and explain to people and tell people what they needed to know. Because, like I said, we get information from so many places, but like one thing I would have liked at the national level is that, I understand the credentials of Dr. Fauci. I would have loved if they gave him more time to talk with like more of his staff, or like more, like not just up there next to the president and here you get a podium and you get to talk for 10 minutes. I would have loved to see more with him, with maybe some of his staff or other experts, kind of like how the CDC does their press conferences, where they have a table and they're sitting, you know what I mean?
Right.
Because here, we're not getting that. We get the president, we get this guy, we get this person in this box next to this reporter in this box, and they talk for 5 minutes. And okay, here's what we talked about this before when you got to go on the morning show. It's like, okay, thank you for being here. You got 5 minutes. You got 5 minutes to save the world. Tell us everything we need to stay healthy in 5 minutes. Thank you. All right, bye. So
it just doesn't work like that. Honestly, it goes back to the leadership, being able to create a forum for the experts to disseminate the information in a very meaningful way for our population. So we know nationally that we've had 4.3 million people diagnosed with COVID-19, and of those people, we have 150,000 deaths in the U.S. 150,000 deaths compared to the population of the U.S., people say, well, that's not that much, unless it happens to be one of your loved ones. There's cities that are this size. So essentially, this has wiped out a city. And so when you think about it in those terms, it should give you pause, honestly, that we've had this amount and we're still climbing. Actually, particularly in California, so we saw June 12th, we saw the opening of gyms and other things, and expeditiously we saw a huge spike, not a little spike, a very large spike in the amount of diagnoses. And we know that when people get diagnosed, your mortality rates go up, which i.e. means your death rate goes up. And so if we can flatten the curve, is what they have always been calling it, then by flattening the curve, then hopefully we can decrease the risk of death in patients who contract COVID-19. So I always start looking like at a national level, like you were talking about. And so yes, having Dr. Fauci available and let me just state for the record, there's a lot of discussion about Dr. Fauci, his credentials. I've known who Dr. Fauci was, I would say over 10 years. He's written he's been co-editor on a lot of books, medical books. Everybody's not going to like everybody or what they've done in the past or how they handled a certain situation. But I think that lending the experts the ability to actually do their job says a lot about our country. You would not want me to fix your car. Right? I mean, you would want to take it to someone. If you paid all this money for a very nice car, you wouldn't take it to just anybody for them to fix it. And I feel like the same needs to be true with our medical professionals. We have to really give them the ability to treat us and to take care of us in a real way. And so from a national level, that is, I agree, 100%. I know nationally we just had where the numbers were not going to the CDC for a short amount of time.
Right. Did they reverse that? Did they change that?
That has been reversed as far as I know. If I'm incorrect, somebody can correct me. But as far as I know, that's been repealed. And so that's just another example of perhaps why people are reacting this way to wearing a mask.
Right.
Because when leadership exhibits like they don't either trust or have faith in the people who are providing the care and doing what they're supposed to be doing, then why should the person who lives locally have faith or trust in them?
Right.
Why should they? So I think it's about how you present the information and who you present to present that information. So that's very important. When we're talking about California, I have some numbers here. So as far as California, we've had 459,000 people diagnosed with COVID-19. Of that, we've had 8,451 deaths. Now, there are certain areas that are a little more hard hit than others. I know LA was one of the hot spots that really had a lot of COVID-19. Up in Northern California, around San Jose, initially when we first had our outbreak starting, that area was pretty taxed as well. And then actually one of the other hot spots is here in San Diego, Imperial County and South Bay. Those are the two areas in San Diego.
County got hit.
Yes, Imperial County is still getting hit really hard with COVID-19 right now. And so when you look at national, then you look at state, and then you look at our city, San Diego. There are two websites that you can go to find out all this information. Well, there's more than two. You can actually, I would say, the trusted websites that I utilize. We use CDC information because that has always been the golden standard for treatment of communicable diseases. I don't know why we would shy away from that now.
At this point, right?
At this point.
Yeah.
I mean, this has been the gold standard. And when people use the term gold standard in medicine, that means that is the supreme, the creme de la creme, the fluff on the top of the lemon meringue pie. That's where you go. And I don't understand why that has changed. The next thing is that you would go to the state. So we have state, I think it's california.gov, where you can go on there and have a specific place where you can look for your area where you live, if you don't live in San Diego, to find out information about your particular city. And then within San Diego, we have sandiego.org. We have Live Well San Diego, which is a fantastic organization. Dr. Wilma Wooten is our public health physician and has been providing daily updates pretty much with regards to recommendations, current restrictions, where we are with our numbers. And we are now, 5 months into this? And so we've been getting information pretty consistently as well as they can provide it at the time. And I think that the response was swift in a lot of ways and shapes and forms. I can tell you right now, and these numbers are from yesterday, because when we got ready to do the podcast, the numbers weren't up. So every day there's a reporting of numbers, and so that information is always up to date, usually within the last 24 hours on sandiego.gov. Right now we have 26,968 cases of COVID positive in San Diego. Is that
county?
That's San Diego County. And so that is positive 283 cases in 24 hours. So of those, and then this is where we really start teasing this out. Of those cases, 2,391 have been hospitalized. So this is where we start thinking about our impact on our healthcare system, our impact on our beds in the hospital. There's been 614 ICU admissions. So it doesn't necessarily mean that you are on a ventilator or on life support when you're admitted to the ICU, but you are sick enough for them to be monitoring you much more closely, and you are more critically ill than someone else.
Right.
And of those, there's been 533 deaths in San Diego County. Imperial County alone had 9,064 cases, which was positive 48 cases yesterday. And so one of the things that most people have been interested in is, of course, what's the ethnic breakdown on those numbers?
Right.
And so I will tell you, one of the things that I found interesting is that the largest group of people who have COVID right now in San Diego County are 30 to 39-year-olds. Not
this elderly thing that.
So the pendulum has shifted, but that shows you that perhaps our elderly are doing a good job of staying home.
Right. I know my mom is.
Right? They're staying home. They're not going out. But when you go out around the city, who do you see out?
Yeah.
Perhaps
exactly.
not wearing their mask.
Yeah, exactly.
Perhaps not as engaged in physically distancing. Perhaps having, this phenomenon of COVID parties.
COVID parties, yeah, I saw that. I was like, what?
That's the largest group right now that we're seeing. So it doesn't mean that just because you're healthy, you're not any less at risk of having some severe complications as this is concerned. So in those areas, when we're talking about age, when we're talking about South Bay and Imperial County, Chula Vista has 13% of the COVID cases in San Diego County, which correlates with Hispanics having 61% of the cases in San Diego County.
Wow.
Caucasians are at 25%. Asians have surpassed African Americans or blacks with 6%, and
really?
blacks are 4.7%. And San Diego City proper has 11,801 cases, which is 44%. So, of course, the city of San Diego makes sense because that area is better. Right. But when you compare that to Chula Vista, and Chula Vista is the next largest at 14%, and all the additional cities are 4% or less in San Diego County, pretty much. So that shows you how hard hit Chula Vista, South Bay, Imperial County are being hit. Now, a lot of people are trying to hypothesize why these numbers are so high. One of them is living situation. Hispanics or people of Mexican descent typically sometimes have multi-generational living in the house, right? They may not have the resources to separate and go and live someplace else, while this is going on, or to socially distance from other people in the house. Those are just some of the ideas. That doesn't mean that they're necessarily true. Right. But as we try to figure out why certain people are more at risk, we know that if you have, like lung disease, if you have asthma, if you have COPD, anything that weakens your immune system, just like any other disease, puts you at a higher risk. And
it might be like that in other parts of the country where African Americans stay in very concentrated places and have the same type of things, where they're living multi-generational and they can't spread out.
Exactly. And one of the interesting things when you start looking at the numbers, and people are kind of teasing out the numbers, in the Asian community, Filipinos are a large portion of that Asian community that's comprising that 6% that has bypassed Black or African Americans. So that's very interesting in itself. I was on a call the other day, and they were hypothesizing, particularly like if you look at like LA County, not necessarily San Diego, but LA County, a large majority of Filipinos are healthcare workers. And so, depending on what you do for a living, I believe the highest ranked people at risk right now are dental and hygienists, because they deal directly with the mouth, directly with saliva and things like that. So I think that that's important to kind of tease out those numbers and kind of look. I know in San Diego we're trying to get a better idea of exact numbers, because in some areas they don't necessarily ask you your ethnicity. And then we know that for like our Middle Eastern brothers and sisters, some of them are identified as Caucasian. So, like some of these numbers are kind of, we're taking them at face value. But until you really start digging and teasing. But right now we're in the middle of this pandemic, and we're just trying to do the best that we can with the information that we have, and trying to put our fingers on things.
Because like this stuff with anything else, like sometimes you don't get real numbers until years later, when you can really sift through all that data.
Right. But visual learning and numbers is one thing, when you see a large population like they were seeing back on the East Coast of Black people dying, you don't necessarily need to see the numbers. You see it before your eyes. And I think that that's important translation with people trying to physically distance, is that I think I was reading, like the impact that it has on hospitals, ICU beds. Right now in our county, people aren't The only time you can really, most hospitals have a moratorium on visiting. You can't visit anybody in the hospital. And the only people that are allowed to visit are in ICU. So your loved one has to be extremely critically ill in order for you to be able to see them.
Right.
And that's if they don't have COVID-19. If they have COVID-19, there are some hospitals that you're not even allowed to see them then. And we know that if someone has a medical problem that's not related to COVID-19, and then subsequently they have COVID-19, their illness is much worse. Because when you get sick and you're acutely ill, any of your problems that you have, diabetes, hypertension, those things get worsened. COVID-19 is no different. So those are just some of the numbers and some of the things that we're dealing with in San Diego County, and just trying to make sure that we have accurate numbers and people are getting tested.
Right. Let's talk about that. Let's talk about testing, because that seems to be another thing that people kind of don't understand. That's been confusing to me. Who should get tested? In what order should people get tested? Is there a hierarchy of people who should get tested, or who will have more priority of getting tested over others?
If you have symptoms, going to the testing center may not be the best idea.
Right.
Because then you've kind of exposed everyone
right.
in that area. If you've been, I would say, number one, if you've been exposed to someone who you find out later that is COVID positive, and you don't have any symptoms, or you have very minute symptoms like loss of taste and loss of smell, wear your mask and you can go in and get tested. We know that the symptoms of COVID-19 are, let me just list them for prosperity, just to make sure we know, fever. And when I say fever, typically people who have fever, it's not 100 degrees. It's not, my temperature's normally 98 and I'm 100 or I'm 99. These patients are coming in with fevers of 101, 102, 103. Their fevers are extremely high, and Tylenol is typically not helping.
Right.
And those are the patients we're seeing in the hospital setting. But Tylenol is one of the treatments. If you have COVID-19 and you're at home dealing with your symptoms, that is one of the medications you can take. Shortness of breath. That's unlike anything else you've ever had. So you get very winded. You cannot walk for short distances. Those are people who are more critically and ill that need to report to the hospital. But shortness of breath, when you don't have any lung issues. If you have COPD or CHF, it's hard to figure out which one of those it might be coming from. But if you don't have any lung history and all of a sudden you're short of breath and it's hard for you to breathe, you should be concerned. If you have loss of taste or smell, that's another symptom that we figured out, because that initially wasn't one of the symptoms, right? So through research, we've actually found out that a lot of these patients are having loss of taste or smell. The other one that sometimes people miss is GI upset, so diarrhea. That is one of the ones that, because what we've seen or what we believe is happening is that COVID can also deposit into your gut or into your intestines, and it gives you like a stomach bug. So you can have diarrhea. And I'm not talking about diarrhea for like 4 hours. I'm talking about diarrhea day after day after day. Nausea and vomiting is another one. Can't keep any food down. I had a friend that actually had COVID and had really bad diarrhea at first, and then it turned into the respiratory symptoms, but had lost a huge amount of weight before it was actually caught that no, it's not gastritis, it's actually COVID. So those
I'm glad you said that, as far as like, because sometimes when those lists came out and you look at a list of symptoms and you go like, oh, well, I have that all the time, or that happens all the time. Like, like if it's just listed like, oh, these are symptoms: shortness of breath, diarrhea. But people like look at it like, oh, well, I have shortness of breath every now and then. So then they end up dismissing it. But I'm listening to you now say like, no, not just you had shortness of breath, as in like, no, you couldn't walk from here to there. Mm-hmm. This continued. This is a continuing thing. Mm-hmm. This is out of the normal. Because sometimes people look at those lists and it's like, oh, well, how am I supposed to know? That sounds like...
Mm-hmm. And coughing and wheezing, those are, of course, the obvious ones as well. But I think that the symptoms can be very mild or be very extreme. And that's the other caveat when we're dealing with COVID-19, is that the symptoms are so vast in symptomatology, as far as, you may have COVID, not that you have it, but you may have COVID and your symptoms are very mild.
Right.
I may get COVID and I may end up in the ICU. There's no rhyme or reason as to why one person gets sicker than the other. Even if we have the exact same medical history, background, we're both healthy, fit people, because my friend, very fit, no significant health issues, in 40s, and was in the hospital for 5 days with really bad COVID, lost like 30 pounds. So, I mean, it varies from person to person. But as it relates to testing, there's several areas in San Diego, particularly Southeast San Diego. And I say Southeast San Diego because as San Diego Black nurses, we focus on our community as a whole, but particularly the health and welfare of African Americans as an underrepresented group. So in Southeast San Diego, there's 3 areas, and I'm going to read. There's a couple of areas. The first one is Tubman Chavez. They have walk-in appointments from 8:30 to 5, and that's Sunday through Saturday. I will tell anybody who's listening right now that you need to double check any information that I'm telling you as it regards to testing, because the information does change depending on the need of the community. Right. And so initially Tubman Chavez was by appointment only. What they were figuring out is that they had this amount of appointments to see people, and people were making appointments, but they were no-showing. And so when you no-show, then that alleviates somebody else who needs to come in to be seen. And so Tubman Chavez is now walk-in, okay? Euclid Health Center is on Saturdays from 9 to 3. It's drive-up. It is by appointment. Kimball Senior Citizen is on Saturdays from 7 a.m. to 7 p.m. It's walk-up and appointment. St. Anthony's of Padua, please forgive me if I said that name wrong. They have a parking lot testing where they do it Sunday from 10 a.m. to 2 p.m. only. It's drive-up and appointment. And if you live in any other area in San Diego, you can go on sd.org and look up all the information. You can look by your zip code. And I would really encourage that if you have an opportunity to call or to either just double check and make sure that you have the complete details about the testing site, so that you're well prepared when you arrive. Right. So that if you have to have an appointment, you make an appointment, because I would hate for you to go there and then find out that it's appointment only. So I think the other thing to talk about is the turnaround time for testing.
Yeah.
It varies greatly. And so, sorry about that. I thought I turned off everything. Electronics. Forgot about my watch.
That's our world. Every time you think you got everything turned off, there's some beep from somewhere else.
Yeah, there's a beep from someplace else. I was saying, what was I saying?
Turnaround time. Yeah.
Turnaround time for testing can be anywhere from 72 hours to, I would say, as far as 7 days. I mean, the thing you have to understand is that there's such a large amount of tests that are being done. And so, and then also, when they do find someone that's positive, there's a call that has to be had and education that has to be given from someone within the public health spectrum. Number one, to gather your details, to call you, to ask you, okay, you've tested positive for COVID. Who else have you been around? Perhaps we need to notify them. Okay, you need to notify them and let them know that you're COVID positive. They need to be tested. Are you having any real symptoms? Do we need to direct you to the hospital? We need to take care of you. And so it's not like any other healthcare issue or that we've been dealing with in San Diego. It's just information. It's teaching, educating, and being educated as a citizen of San Diego and receiving that education in a real meaningful way.
And you have to be responsible with it. I mean, you know, when we first started the lockdown, you know, had already been kind of scaling back about who was coming to work and who wasn't. Those last couple of days, you know, people are coming in to make those last arrangements to get ready to go work from home. And, you know, we had someone who had tested positive for it. And so there was like 3 of us who had been around that person. Like no one else had been at work, but there were 3 of us. So, okay, 3 of us had to self-quarantine. You know what I mean? Because we were the last 3 who were around that person within that time frame. Mm-hmm. And it's just like, just be responsible, people. Just be responsible. Like even if you don't care about you, you know, even if like me, I think I'm a big bad man. I'm healthy all the time. But mm-hmm. Okay, even if that's the case, I got little ones. I got elderly parents at home. I got elderly aunt at home. Okay, so I need to lock myself down until we figure out what's going on. It's just a thing of responsibility. And if you're, you know, there's so many people out here just so big, bad, and blustery, but do you really know? Are you just being big, bad, and blustery because you're just being big, bad, and blustery and you want to be a contrarian, but in the back of your mind at night, if you're big and bad and defiant, but at night you're going like,
they're big and bad and defiant until they get to the hospital and they can't breathe.
or someone they know is in the hospital and can't breathe. And you know, or they get the call from the family member, hey, guess what? I tested positive. And it's like, oh, really?
And then you have to, you know, we have to be, for lack of a better word, our brother's keeper. Mm-hmm. If you have it, it's your responsibility, like you were saying, to educate the people around you that you have it. Mm-hmm. Just even if it just makes them more aware of them limiting themselves from the people that they love, so that, you know, until they know for sure that they don't have it. Right. You know, quarantine and isolating are 2 different things, right? So, you know, quarantining is when you know that you have it and you stay away from people at all costs because you don't want them to be around. Isolation is when you suspect you might have it, you're not going around people, you're limiting your you know, for like what you did. You know, when your coworker had it, you went home, I'm sure you were not around people, you wore your mask, you make sure you go over here, you stay away for a certain amount of time, you know, which is recommended between about 10 days to stay isolated. And then, you know, you can come back out if you don't have any symptoms. You have to make sure you don't have any fever. You know, one of the big things is when people actually have COVID-19, they're not supposed to be around other people until they don't have a fever for 24 hours without any Tylenol. That's the most important thing.
Without.
If you're still taking Tylenol because you have a fever, you should not be out and about.
Right.
That's not controlled. You're still very much putting other people at risk. And so that is a very important point to drive home. There's just so many different nuances of this. I think that as an individual, as a person who maybe has a family or anything like that, I think that it's important to do the research and not take somebody else's word for it. Go directly to the trusted sources and find the information for yourself. Please do not be listening to the person on Facebook who says boil onions. This is real. It's real. And they sent it to me. I really thought that was really funny. You sent that to me knowing what I do. I'm like, no, that's not good. I'm not going to be boiling onions to decrease my risk of getting COVID-19. I don't think that's going to help me, but thanks. I think you can do things that make yourself well. You know, taking vitamins, you know, making sure that you are, you know, staying as healthy as you can, you know.
That seems to be what's missing from the dialogue or the national dialogue. Like that's one thing that I've seen that seems to be has been missing on a national scale from this is what people can do to keep themselves healthy. You know what I mean? That just seems to be missing. Like, just like what you said right there, just even taking for a minute, if someone said take vitamins, it was almost like they got shouted down. Like, well, that's not gonna. I'm like, no one's saying that's gonna stop anything.
No,
we're saying, but what you can do to keep yourself optimal,
keep your immunity up, keep yourself healthy. You know, but that goes along with washing your hands.
Right.
That is immunity. I mean, washing your hands keeps you healthy. And I'm not talking about now. You know, there's a way you wash your hands.
Right.
Most people don't wash their hands correctly. Dipping your hand in water, a little squirt of soap, run around. That's not washing your hands.
That's like my daughter and my son whenever my sister's around and they get done eating, they run in the bathroom, come back. My sister's like, "Let me smell your hands. Get over here. You wasn't in there long enough. Go."
That's right. And then hand sanitizer too. You can only use hand sanitizer. So most of the time what we do in the hospital and what infectious disease recommends is if you use hand sanitizer 5 times, you then need to wash your hands. Because think about it, you've just been taking that and washing over your hands. That's one. Have you ever used hand sanitizer a lot, like a couple of times? How sticky does your hands get? Yeah. I mean, and right now we're using hand sanitizer. I mean, we're making it at all costs at this point, right?
Everybody's making it.
Everybody's making it. Yeah. Yes, everybody's mass producing it, right?
Right.
If I use hand sanitizer more than 3 to 4 times, I wash my hands because it's time to wash.
Right.
You know, there's nothing like soap and water. I mean, you can't understate that. And 30 seconds, brisk scrub is good. And if you wash your hands, most things come out okay.
Right.
Washing your hands. I mean, it seems so simple.
Right.
But do you know how many people don't do it?
Yeah.
Even before COVID-19.
Right,
it's
before
scary.
that. If
you've ever been in a public restroom, you know what I'm talking about.
Exactly.
You've seen those people that go in there, use the restroom, and don't wash their hands. I'm just like, okay. I cringe.
I will not disclose the location, but I will say I remember a place where there's a group of people who would give like the little, like in the mall would give like the little massages. Like you walk by, they'd be outside with little massage chairs, and they would come use the bathroom where I worked at. And I would make sure I told everybody I knew who came in that area, do not, at any cost, go get massages from those people. Trust me on this one. I've done the research. Their hands are not clean. Like Cat Williams said, I've done the research.
That's so
Their
gross.
hands are not clean. Yeah,
so horrible.
It's the real world, people. It's the real world out there.
Listen,
that's why we're going through this.
I don't understand. What is the deal with not washing your hands? It's just so gross. Ugh. I just wash my hands so much. I wash them all the time. But yeah, in San Diego, I mean, I feel like we are doing a good job. We are having, some of our numbers are going up, particularly in Imperial County, because we have expats, some of them from Mexico, coming back. Mexico is really suffering, especially Baja, with a lot of COVID-19. And so because, you know, we have a lot of people that may live over there but work here in the States, I want to say of all ethnicities, I want to say that, that it does affect the numbers. And so what you're seeing is even people from Baja or Imperial County are being shipped as far as Irvine to the hospitals up there. Wow. The hospitals in Imperial County they're not built for a pandemic, you know. They have relationships.
Because the population is not even.
But it's not even about the population, it's the access to healthcare.
Right.
The access to healthcare. Any place where people were suffering with access to healthcare, now with the pandemic, they are in more dire need than ever, because we know that direct access to healthcare has a direct link to mortality, access to healthy foods, access to all kinds of things that don't affect people who have all those things. And so it's a palpable thing that people in those areas are suffering, you know? And so the hospitals in Imperial County cannot handle that. They have relationships with hospitals in San Diego for a reason, because when there is an acute illness, or if there's somebody who has so many problems that their staff, or that they're just, they're not equipped, and they don't have all the big fancy machines, and they don't have all the specialties, out there, that they come into San Diego proper to be managed.
And that's just geographically, because of how Imperial County is. It's like it's in that little pocket. Like you leave San Diego, you get over the mountains, you come down. In Imperial County, it's in the middle of the desert.
Yeah,
and
just
really
geographically.
Nothing else until you get to Arizona.
Right. So either they're going to Arizona, or they're coming to San Diego, and it's closer to come to San Diego, so it makes sense for them to have, access to us.
Right.
But even dealing with that, you have hospitals in San Diego that are their dedicated COVID-19 areas are really getting worked a lot. You have providers that are going down to Mexico to help there, trying to make sure that the standard of care is the same for everyone, because what affects Baja affects San Diego indirectly, whether you want to admit it or not. It does. And so no matter how you feel about that, no matter what your thoughts are on that, it just is a fact.
And so that would be the same, like I'm thinking about places like where my parents grew up in Alabama, in rural places where there's just not that many hospitals, or just the access to healthcare is not that great. So the bigger cities like Montgomery or Birmingham, they're going to get taxed, because the people have to come out of all those rural areas around there and go to the bigger hospital centers in the bigger cities.
Exactly. They have to go somewhere where they can get, access to the best care that they can, and smaller clinics and smaller hospitals are just not equipped for that.
Right.
That's why, the hospitals there's different levels of hospitals. A larger hospital that has all those access to everything, they're called a tertiary hospital. The hospitals in Imperial County are not necessarily tertiary hospitals. They're not. And so because of that, they have to find partnership a lot of times with larger healthcare systems to help them, either it be with surgery, emergency, staff. I know recently there have been several hospitals in California where they've actually asked for help from the state, from the government, and they actually sent people from the National Guard there, who were physicians and nurses that were enlisted people who were active, to go to those specific hospitals to help, because the staff, you also have to understand, the staff is being worked.
Of course.
Worked. And when I say staff, I'm not just talking about nurses and people who provide direct access to healthcare. I'm talking about your housekeepers. I'm talking about the people, the janitorial. I'm talking about the people who make your food. Right. I'm talking about the people who check you in. I'm talking about every single person, because what you have to understand about healthcare is that everybody's important. Everybody, from the bottom up. There's really no bottom. Actually, it's a level playing field, because without one component, the other component can't do their job well. And so we have to work together, and that's where the public working together to make sure that we're staying as healthy as we can, to ease the burden on the healthcare system, is very important.
Where do we no, I don't want to get to that. I don't want to go there yet. I know you wanted to talk about Mrs. Wooten. So I know there was an issue that I didn't really get into that much, but I know what the issue is, and it's something I've seen happening, not just with this situation, but just period across the country, media-wise, social media-wise, and that's this issue of people being doxxed, just people's personal information being put out there for whatever reason. And I know that ties into, give me a little background on that, because I know that ties into her doing the, like you said, almost doing the daily press conferences on that. And
yeah, public health officials have really had to take, well, it's their job. This is what they're in those positions for, so that when there's a pandemic, when there's a public health crisis, that they step up to the plate, help organize, make sure people are getting informed, make sure that every section of the city is trying to get what they need, making sure that they are providing the best care that they can. And what we've been seeing around, not just in San Diego, but around the country, is that there's an attack on public health officials, where their private information is being released, whether it be their home addresses, their telephone numbers, their family members' information, their family members' telephone numbers. I know that I'm not particularly familiar with exactly the name of the public health official up in Orange County, but I believe they were targeted. So was someone that was directly related to them. And they've had some public health officials quit. Can you imagine what happens to those cities? What happens to those areas? I mean, there's always someone that can step in, but it's very disheartening to dedicate yourself to a city, a community, and then have that community turn on you because they feel like you're against them in some way.
Yeah.
When you are really, truly trying to make them safe, do your job, and do the best with the information that you have and take care of everyone involved.
Right.
You know, the hardest decisions in life sometimes, particularly, are made, and, you know, not everybody's going to agree. But I think there's a sense of humanity that has to be continued as it relates to whatever we do in life. There has to be a sense of humanity as it relates to people who are just trying to care for us and take care of us. But that goes back to that trust and that leadership and all those other issues that we're dealing with. I will have to say that Dr. Wooten was supported by the County of Commissioners, who actually took a stand and made a statement as it relates to people attacking her and attacking her character, because Dr. Wooten saw us through the hepatitis outbreak.
Right. Which was horrible. I don't know if people remember that now.
It wasn't even that long ago.
People's memories are so short. That wasn't
3 years ago?
Yeah. I don't know. And
3-4 years ago at the maximum.
I don't think people remember. Like, I was working downtown and it was just bad. Like, yeah, that was a horrible, horrible outbreak. I think this is just, like I said, people's memories get really short about how bad that I don't know if you call it epidemic, but that hepatitis case, that was really, really bad. It was really scary.
Yeah, and when you think of places up in, like, our state capital, Sacramento, and areas like that, the things that they did to implement to quash that hepatitis, and we call it like an outbreak, is pivotal for the health of the general community. I mean, because even if it just affects a small group, if it affects that group and it transcends into other groups, then it starts gaining momentum. But I think that's something very important, and that just leads more into the things that we need to do as a community and safeguarding those people who are dedicated to making sure that we're safe.
Right.
And so I think that it's very easy to sideline quarterback that when you don't have all the details as it relates to the decisions that are being made. I mean, people who dedicate themselves to health and well-being of others typically are not interested in making people upset and doing anything to infringe on them that's not related to health safety.
Right. I think that comes along with where it becomes from a level above that and levels below that, to where the politics come in, and how, because those people in that public sphere that are in that space, sometimes they get used. They get used as pawns, or they get used as pawn pieces from those who have other motives in seeing whatever message they want to get out. So they use those people in that space.
It comes down to safety.
Yeah.
I mean, you are a public servant. Now, I mean, But when you wake up, you're not a politician. You're
right.
not someone who's running for office.
Right.
You're just doing your job.
Right.
The best way that you know how, and you have people calling your home, giving you death threats, calling you names, particularly because Dr. Wooten is an African American woman.
Mm-hmm.
There is a component of, we know that systemic racism is prevalent in the U.S., and so you're having to deal with that now on top of everything else.
Right. And you're just trying to keep people safe.
Exactly.
That's what that's all you're trying to do.
That's all you're trying to do. Punish.
So here we are. We're at this point where we see things are spiking back up. But to go along with that, as things spike back up, things close back down. And so now we have all these other things on the periphery. Now we have mental health. We have dealing with, how are we dealing with the mental health of our children? We're dealing with what I don't know if people really understand. I can say this as, a father of some little ones, and now, my oldest just having a grandbaby, about 2 weeks ago. It's supposed to be time for school. Mm-hmm. And I don't know if people understand. Everyone's stressed out. I know with the older kids, it's one thing. When you got kids who are in junior high and high school, you can manage that a little better. They're older, the learning's different. But like right now, this would be when the twins are entering kindergarten. Mm-hmm. This would be their kindergarten time.
Right.
I'm stressed out, and their mom is stressed out because we're not educators.
And you're having to homeschool them.
You know what I'm saying? I'm not an educator. I'm not, and I get it. I am not an educator. So I'm sitting going like, okay, I don't think people understand. Like, oh, what they give them computers. I'm like, they're 5.
Yes. So listen, my heart goes out to people who have children at home. I am an empty nester. Throw my hands up. Yes. I am an empty nester. My daughter is in college, and even now she's complaining because
they gotta come. They can't be on campus.
And she's got to try to get her classes. She's supposed to graduate, so she's trying to graduate, and she's trying to get classes, and she's like, "Mom, I can't graduate."
Yeah.
So my heart goes out to people who are homeschooling their children. You have to, especially if you have to work, or let's say you have children at home and you got laid off from your job and you don't have your job anymore, and you're trying to figure out how you're going to pay your bills, and at the same time you have to be focused enough to educate your children and do homeschooling. Let's talk about the children who are special needs children. How are we educating them, and what does that curriculum look like? What does it look like when they go back to school? How do you physically distance a 5-year-old?
Yeah. They are the exact opposite of social distancing.
They are hugs and kisses. They are bubble gum on the face. Right. They are all those things. They are snotty nose running. Yes, they're little petri dishes of happiness. So, what does that look like? And even with older kids, they need socialization, and I think that's why when you look at the numbers, what we were talking about earlier is that age group 30 to 39. I wonder if we're going to start seeing shifts. Who knows? Don't really know.
Don't know.
We can only hypothesize at this point.
We haven't been through this on this level. We haven't been. This generation has not been.
No.
Even my dad's generation, they haven't been through this like this. This is new. This is a whole new thing.
But can you imagine this pandemic 20 years ago, before we had all the technology that we have? Can you imagine? We have so much technology now. We have Zoom. We have Google. This is not an endorsement of any.
But it's just our world. It's just the world we're in now.
These are the things. These are the world that we're in, and But then you have people that you can't work from home. You can't work from home, and then you have people that can work from home, and then you have people, the economic strife that it's created, the mental health component that it's created for people who suffer with depression and mental illness and mental disease and, also domestic violence. You're at home now, perhaps, more than you would be normally with your abuser, whoever that person is. Child abuse, all those numbers that we look at. And we've had a shift in how such a palpable shift in how we're living our lives every day, that if you're not careful and if you don't take that time to really care for yourself and watch out for others, depression is a real thing.
Real thing.
It's a real thing, and it can make people really hurt themselves.
Mm-hmm.
And we got to check on each other. I mean, it's not just caring about each other's health, but their mental health as well. We got to check on each other. Call your neighbor, Maybe you don't ever even talk to your neighbor before. Maybe you just knock on the door and back up 15 feet and go, hey, just checking on you,
It's like we were talking about earlier, how I was telling you how, my whole day got thrown off from this tire situation. But, my tire being flat today and the spare being flat. But, the thing I got from that is right now we are in this situation and, as this has progressed and, people kind of got scared to be social and talk to everyone and be too close. And I'm sitting there today and I'm changing my tire and the spare is, the spare is flat. And here comes this guy, he's driving by and he's like, he sees me putting the real tire in the back of the car and he sees my spare is flat and he's like, oh, well, that's not going to do any good, is it? And I'm like, no. He's like, look, man, I got an air compressor in the driveway. Back your car up in here and I'll fill it up for you so you can do what you got to do, And it's just at that moment where you are having this horrible day and you're in this world right now where everybody's scared to be close to each other. But here's this guy who's just like, hey, come in there, and he's talking about his house and his wife and this and that, and he just, even in the midst of my mind going like, great, I got it. But here is this moment where this guy stopped, didn't have to talk to me. He sees I'm stressed out and he's talking to me. Probably a guy who would never imagine us talking at any other time.
Right.
You know what I mean? But it's like you're saying, like, even when you're looking at people right now who, even things that to some people seems ridiculous. Well, why do people want to go back to the gym so bad? I go, because sometimes the gym is what saved some people's life.
Right.
The gym, that workout is what has saved their life. It's what has kept them sane for all these years. And now those outlets have been taken away. Like, we don't know what keeps the next person sane.
Right.
I know that because I've been having a hard time because working out is what kept my mental straight. Like, I've been in sports and working out since I was 12, 13. And I've dealt with depression, and one of the mainstays that kept it under control for me all of these years was sports. Once I got diagnosed with osteoarthritis, couldn't play basketball anymore, I had to make a switch because that was my thing. That's where I let it all go. It was on the basketball court. Okay, now I got to figure out how to do this. Wait, now all the gyms are closed. Now there's this. Now you can't leave the house. So I'm like, even though I'm trying to find ways to keep it under control, there are people that has been their saving grace. That has been the thing. There's been people who have turned their whole lives around and like they work out so hard because that's been the mental outlet to keep them from flipping out. So I just use that as just one example. And so like you said, now there's people who are just, for some people, it was going to work every day was the thing that kept them sane.
Right.
That just, not just the work, but
being around people.
The process of getting up, that routine, getting up, saying hi to Joe at this coffee shop in the morning, getting your bagel from this person, seeing this person at the store every day. That was part of your routine. Down the drive home, seeing this person, this security guard here. That was part of your routine that kept you sane. That's all gone.
Right.
Now you got to find out some way to deal with that. Like you said, now you're coming home to different stresses. Maybe now your partner, what kept them sane was you not being home all day.
Well, they're gone. I'm happy.
Because maybe while you were gone, that was their space that they operated to keep themselves sane.
Yes.
Now the kids are home all day.
Yeah, you need a break, and you can't get a break because it's like when the beaches were closed, when the parks were closed, when everything was closed, people were literally just at wit's end.
Yeah.
And I think that's when the fear started kicking in and the fight started initially. Yeah. Because with everything being shut down, they just didn't know how to cope.
Yeah. I think one of the worst things that's been for me at this time, through this whole time, one of the worst things, at my work, we kind of developed a thing where we do like now, because, I remember we're doing these virtual meetings, and we kind of just developed this thing to where we just did a daily question for every meeting. Like every day, someone has to ask a daily question. It's a question, whatever.
Right.
And I remember the question came up with like, well, what's the first thing you would do like when the lockdown lifts? And I remember me, one of my coworkers, Kevin, like both of us were like, well, the first thing we want to do is like take our kids to the park because this is killing them. Mm-hmm. And I one of the things I thought was that during this whole time I was like, I get they had to close the parks, and I get they had to close down the apparatus. I go, but one of the worst things I thought they did was putting yellow tape around everything. Like that, for me, I was like, could we have figured out something else to put it? Because
especially for certain communities.
Yes, because my kids see yellow tape, and they're like, no one sees yellow tape unless something is wrong. Right. And sometimes, most of the time, definitely you're crime wrong.
Yes.
And you drive by and you just see playgrounds with yellow tape. And so my son and my daughter were like, Dad, what's up with what's going on with the park? Why is it yellow? What's up with that?
What happened there? Right? Did something bad happen, Daddy?
But these are the things that go to like these mental things that we have to be looking, like we have to be dealing with.
It almost makes me wonder how, like the twins being 5, how this is going to affect them, depending on how long this lasts. Because we really don't know how long this is going to last. Yeah. So, I mean, September is flu season. Yeah. I don't know if people, are understanding that there are other things on top of all this. There's other things out there besides COVID. Did you forget about them? They're still there. Right. So September is flu season. Yeah. Wonder what this is going to be like. Yeah. Wonder what it's going to be like.
Yeah. And then on top of that, even with, I was already dealing with the like, Daddy, why is everybody going to wear a mask? Why do we have to wear a mask? Why do we have to wear a mask when we go with Auntie? Why do we have to do this? Why do we have to do that? And then on top of all this came the George Floyd situation. So now the question went from why is everybody sick? Why is everybody wearing masks? To what's going on with the police? Why is everybody mad? What's going on? And then, I don't know if people are understanding I don't know if people really take the time to understand how it's affecting themselves. Because I know I've had times where I've been like, oh, why have I been so angry thinking I'm under control, thinking I'm understanding myself every day. And then one day it pops up and I'm going like, oh, man, I've been tripping. I've been yelling at the kids. I've been talking crazy to people. My temper has been like that, and realizing like, oh, because the world is crazy right now. And I'm
the world has been crazy.
It's been crazy.
It's been crazy. It's just, I had to take a pause too. I took a long pause. Only because it's a lot. I mean, I am not a black man. I'm not. But I have nephews, my dad, I have people that I care about. And, it was almost like, I don't know if it was this way for you, but you build up this tough callus, this tough callus that's on the outside. And you see it and you're like, okay. But then when everybody else saw it and it was like this big thing, it was like the scab was just ripped off. And I mean, when it was ripped off, it was ripped down to the bottom of the sore. And then it was, we made this big shift from you not seeing me at all to now all of a sudden, not only do you see me, but you want me to teach you. And you're sucking the life out of me because I have to educate you now about what's been wrong the entire time when it's been right here in your face.
Right, yeah.
And it was just so, if one more, I mean, are you okay, Sam? People are actually asking me that at work. Are you okay? And I'm like, what do you mean? Oh, you want to have a conversation? Oh, okay. We're gonna have that conversation.
Like, are you sure?
How do I feel about them changing the Aunt Jemima bottle? Let me see. If that ranks super high on the things that we need to reform,
right?
Yeah, not super high on my list.
Yeah, not super high.
Let me see your C-suite.
Yeah,
let's talk about that.
Yeah.
Let me see your leadership.
Yeah, because the Aunt Jemima was not on my mind at all at any time.
The utilization of people of color to define everybody who ain't white. Let's talk about that.
Yeah. Because
we don't want to actually have to say black people.
Yeah.
I mean, you don't want to get me started. I mean, between that and COVID, I mean, it's a lot.
I mean, I think that was the thing, because then you gotta bounce that back and forth, and as you're dealing with it every day, you might not be realizing how much of it is actually sinking in. It's all just kind of creeping down. Like this, I kind of like the analogy I kind of came up with. Like it's kind of like cracks in a glacier. So like when things heat up, there are little cracks in the glacier, and then like the top level of the glacier melts, and so that water is just seeping down in these little cracks in the glacier. But like, I'm gonna geek out on y'all for a minute. So when those cracks creep down into the bottom of the glacier, that actually helps lubricate the glacier moving into the ocean, because the water creeps down and it's colder, so that it moves faster down into the water. So it's this circular thing that helps the glacier move and melt faster as it moves in the warmer water. And like, I feel like that's what's going on with COVID and all this racial stuff right now.
Okay, so COVID
down,
and
slowly,
systemic racism are the glacier, and the stuff is seeping down, and then it's going to set sail eventually?
Not set sail. If you don't watch it, that whole landmass is going to move. That like it's all moving. So it's these things that are creeping down, but it's actually making the whole thing move faster. You don't realize that's what it's doing. It's these little things that are creeping down. You think you have it under control. You think you're dealing with it every day. You think you got a grasp on it, but you don't really look up 3 weeks later and like, why have I been flipping out? Why have I been so angry? Why is my stomach hurting? Why is my head hurting every day? Oh, because I'm stressed out beyond that I realize when I'm stressed out.
Because now, not only was I the black unicorn before, as it relates to what my job is, I'm the only person that I see that looks like me. Now, I'm the great black hope. Here to answer all your questions for all of black people in America and in healthcare.
Right.
I mean, in some ways, that is kind of what, but San Diego Black Nurses is here because of representation back in the past.
Right.
How the system worked.
Right.
And we continue to be that way because we know that there's still a lot of work to be done as it relates to medicine and equality. Health equity is a major issue. It's been an issue. It doesn't matter what minority group you look at, it's an issue.
Yeah.
Unfortunately, for blacks or African Americans, we weren't thought as people. And so that systemic racism is really embedded in even how we treat patients. One of the things that we can talk about right now that I kind of wanted to talk about is we're going to go back to the COVID. So San Diego is a selected site for the new vaccination.
Oh yeah, let's talk about this. Yeah, let's talk. Yeah.
Yeah.
Yeah, let's talk about this.
Yeah.
Yeah. Even my mama don't know how she feel about this, right? Even my mom. I told my mom about the other day. I was like, "Hey, mom, so they wanted black folks to get it first." My mom was like, "What?" because my mom and dad, they come out of the South in the 40s and 50s, and they come out of the South to when everybody came through and was just getting the shots and didn't even know what they was getting shots for, or was getting lied to about they was getting shots. So they are just very rare. They're just very weary when officials come out and say like, oh, well, we need to give something to this community first, or we're going to start in this community. Mine too, but their radars go up, and
their antennas go up.
Yeah, they're like, wait, what, why us first? What's the reason?
So I'm split. I have 1 foot in the community, and I have 1 foot in healthcare.
Right.
So I'm split right down the middle.
Right.
So I'm like having that battle right now. So I'm going to start with the healthcare foot.
Okay.
So in I want to see what year it was. 2015, maybe even 16, 17, somewhere in there. The NIH came out with the All of Us research. Mm-hmm. Have you heard of that?
I think I've heard of it, but I haven't had time to look
so
into
All of Us research is a effort to garnish and to get information from they're trying to enroll 10 million people into this program. And what it is it's a database, so that when they do research, they have like your blood, they have like what your comorbidities are, your age, all these different things. Do you know that every disease process that we treat, do you know what it's based on, who it's based on? A 50-year-old white male.
Yeah, we had a little bit of this discussion.
Yeah, we had this discussion last time.
Yeah.
And so treatments, because we don't know why things affect other people differently. I mean, it's true. We know that some things just affect us differently, like ACE inhibitors. Like, why do African Americans, when they take ACE inhibitors, develop this cough?
Right.
So that's not necessarily one of the highest treatments for Black people with hypertension. Why is that? We don't know. You want to know why? Because we don't enroll in research. We don't historically enroll in research, right, because of the history of Black people with medicine. Mm-hmm. Tuskegee Airmen.
Mm-hmm. We don't trust it.
Henrietta Lacks. Yeah. Overall, I would say, when you really look at the African American or Black community, they're not very trusting when it comes to healthcare.
Right.
That's why they don't necessarily, not always, and I'm not using this blanket term to say that every single person doesn't listen, but I would just say there's a reason why we don't trust. Mm-hmm. With good reason, all dating back to slavery, right, where we were used as guinea pigs, essentially, for lack of a better word, right, to experiment and test on with no consideration to us as humans.
And that knowledge stays.
That knowledge has stayed and perpetuated as the years have gone by. I mean, even as recently as Henrietta Lacks, mm-hmm, and the HeLa cell. Right. With her and her family only receiving acknowledgement within the last 10 years for her contribution for something that has changed how medicine is performed right now. So there is legitimate reason for people, I'm going to use the term people of color now, mm-hmm, to really not be as engaging. But I say of all the people of color, particularly Black and African Americans, not to want to participate, because it always seems like they always want us. And we're like, why do you want us? Do you want us because you really want to know what the truth is? Or do you want us because you're trying to experiment on us because you feel we're unexpendable? And that ties in directly to the whole movement of Black Lives Matter. And I say that statement as not representation of the organization, but representation of what people think about that. Like, right, we are people. We have feelings. We have conscience. We want the same things you want in life. We want the pursuit of all the things that you have. Mm-hmm. And we want to be respected. So that is my healthcare foot.
Right.
And it's even that it's a little torn, because I understand why people don't trust. But that goes into making sure that our healthcare providers look like the community that they're serving.
Yeah.
I mean, we have to do some really deep digging on this thing to make it. We can't just blame the community all the time. It's us too. We got to do the hard work, right? Because we are the professionals. So that's my healthcare foot.
Okay.
Then the other foot is in the community. Understanding why we need to do it. Because if we're ever going to get better, if we're ever going to have treatments that help us specifically, we have to be willing to give this much.
Right.
And I know they can't see with me holding my fingers up, but it's just a little bit. It's like, I think they're trying to enroll 500 people right now. And I would be scared too. It's like, so you want to read all the fine print. You want to make an educated decision. You want to see what the program is about. You want to see what the risks and hazards are. I mean, I don't know what the answer is. Only people who think for themselves can make that decision, that educated decision themselves.
Right.
But I think just saying no without actually doing the research and understanding what it entails, what they're looking for, what, like, you have to stay informed. I don't know. I really don't know the answer. Because
it's hard to say, yeah, I want to jump in, and like you said, for lack of a better term, I want to jump in and be the guinea pig for something that has never been. I'm going to jump in and be among the first wave of people to be tested for a vaccine that's never existed before, that is being rushed, that we know is being rushed through the clinical. Like, okay, I want to be the. That's a hard decision to make, especially like you said with the history. That's hard for anybody to be like, yeah, I'll go.
Yeah, just anybody without all the history.
Yeah, I'll go. I'll be the first one. Go ahead,
yeah.
Eject me. I'll do it.
Mm-hmm.
That's hard, and it's, if you pile on a history of being experimented on, that magnifies that by 1,000.
Yes. and I understand the rationale why, but you know the definition of insanity, right?
Yeah.
We want a different outcome.
Yeah.
But how do we get there?
Yeah. Exactly.
So I believe that it started today, actually.
Okay.
I actually looked it up because I wanted to see how many, I believe I'm quoting this correctly, is that they wanted to have at least 500 participants. It's based out of UCSD. Dr. Steven Spector, I believe, who is over infectious disease at UCSD, is hosting it. I know they're looking for 30,000 people nationwide, and they're looking for 500 in San Diego. I don't know what other cities are participating, but San Diego was actually one of the first cities for the NIH All of Us research program. So I guess this aligns with that whole theory. And because UCSD and some of our other facilities in the area, like Sharp and all those other areas, I'm not discrediting them, but because the School of Medicine is directly related to UCSD, it makes sense that it would be there.
Right.
We have cutting edge medicine here in San Diego. We're one of the few areas that has a trauma system based upon where you get injured determines where you go to get your care. There's no trying to figure out where to take you. It's already predetermined.
Right.
So, I mean, if you get into a trauma in San Diego, you have a higher expectation of surviving that injury just because you live in San Diego
right.
County. So I'm not really that surprised that it's here. I know just looking at some of the things that they're asking for, Now, they are asking for people who live in South County, particularly South Bay. They do want some people that are over the age of 65. That's controversial, right?
Right, yeah. Yes, I was watching a report on this yesterday. That is a little bit, yeah.
It is controversial. I mean, but we live in San Diego, where we have a large majority of very healthy people over the age of 65 without a lot of comorbidities. I mean, you go out on our streets, you see them every day, jogging, biking, riding. So they're asking for minority groups, essential workers.
Yeah,
so
I saw that.
I'm checking a lot of these boxes right now.
Right.
I'm checking a lot of these boxes. And then people of color or African Americans in particular. I don't know. And then what do you do, like, if you get sick?
Right.
Or if something happens as a result of this, what happens? I mean, people have legitimate questions. But this is no different than any other thing except for the caveats of, people feeling that it was very fast.
Yeah.
I mean, I don't honestly know a lot about the vaccine or how it works, but I think that if you're even thinking about it or considering it, you should at least look into it and make an educated decision for you and your family and your loved ones.
Yeah, that's what it boils down to with everything.
I don't think that we should just shun away and say no all the way across the board, because we're going to continue to have the same type of response to medicines and things like that if we don't participate in some way, shape, or form. It doesn't mean that everybody has to, but I think that the ones that are best suited should. Right. If you're willing to.
Yeah, I think that's with everything. Like, you gotta, and that's what's hard. That's what's hard about today, is that because I think just in the way of this social media paradigm we live in, like, people are so used to getting their information really quickly, and it's almost like a lost.
Oh, they get their news from Facebook.
And people, like, it's hard to get people to read. To read. Well, that's a statement itself. To read. It's even harder to get them to read an article that might take them 10 to 15 minutes to read.
Oh yeah, our attention
to actually
span is
sit
super
down and
short.
read.
If there's a video, we're all for it.
Yeah, but if you got to read an article where you got to keep moving the mouse down the page, like,
it may not be as interesting. Doesn't have pictures.
Right.
The other thing is that, a lot of things that grab your attention, like headers and circles and, conspiracies, and those are the things that grab people's attention.
Yeah.
It's entertaining.
Yeah.
News is entertaining now.
Yeah.
I remember when news was just news.
It's just news, but yeah. C-SPAN might have been one of the worst things that ever happened to the political process, because that's when politicians realized that they're going to be on TV for an hour just by themselves in front of a podium, and they could just
grandstand.
Yeah, and then and then once the ratings went up, news became entertainment. Yeah.
I think, when we were talking about mental health, you got to unplug from this stuff. You got to take a break. Like, we have these fancy phones, these computers we're carrying around in our pockets. Mm-hmm. They actually tell you your screen time. Mm-hmm. Cut that in half. Mm-hmm. If your job is not directly related to that, and even if it is, try to cut it down. Watch what your children are watching on TV. Take a break, a mental break. Sometimes you have to unplug and just find some self-awareness. We use the word a lot, self-care. That's like a trigger word.
Yeah.
But whatever that self-care is for you, if that's running, if that's riding your bike, if it's laying in your backyard, looking up at the sky and not saying a word, if it's meditation, if it's yoga, whatever you gotta find to just relax your mind and alleviate some of that fear and panic.
Yeah.
But for some of us, and for some of those people in our community, the fear and panic is real because they're dealing with issues that it's hard for them to escape from.
Yeah. 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 Yeah, it's hard. It's hard, especially like, you know, like we said, on top of just dealing with the virus itself, but all the collateral that's come along with it of, you know, the loss of jobs, the loss of services, the loss of access to resources. Yeah, it's hard. It's hard for people to escape this thing daily. And, you know, the less fortunate you are, the harder it is to escape from it. You know, I think it was like that big disconnect when kind of this all started. And I can't remember who he is, some billionaire, but his thing was just like, I think he posted like on his Instagram page, like, yeah, I'm social distancing and being, you know, like, I'm okay on my yacht. And he's like got one of those big giant yachts, and people are like, yeah, that's not helping.
Yeah,
that's not helping, buddy.
That's a little one-sided.
Yeah, like, that's not helping. Like, that's not helping people who can't get away from this reality every day.
Who are homeschooling their children, and, you know, one parent's at work and the other one's home with the child or the kids, and if you have more than one, and they're eating you out of house and home because it's not like you're sending them to school.
Yeah.
I mean, people's grocery bills have gone up.
Yeah.
I mean, there's a lot of little minute things that come along with this that people sometimes overlook and don't really understand. I mean, my daughter, when she was home during the summertime, kids eat a lot of food. And, you know, at least when they were at school, you know, they have class time and then they have a dedicated lunchtime. I mean, they can go get in the refrigerator whenever they want when they're at home all day, every day. So there's little things that have to do with that. It's just, you know, we just have to take care of one another. Don't forget to check on your strong friends, too.
Yeah.
People forget about those. Forget about them.
Yeah.
Don't forget the people who you think are ruling the world, the people who are in charge, they're just as stressed as you are.
Right.
So don't forget to, just because they make the load look light doesn't mean that the load is any lighter than what you're carrying. So yeah.
What as we kind of like bring this to a head, because I want you to come back. I want to come back and check up on this. Come back to this subject, because this thing changes so much, and like it almost changes daily. But I feel like we're at a place right now. Like I said, I'm glad you came to talk to me right now, but I feel like we're at this place right now where a lot of things are going to change, because we saw the spikes, we're seeing the closes happen again, and then even on the mental thing, and you know, with this second wave of, you know, businesses closing or having to close. I know Alex is keeping an eye on that. Like I know, you know, like I know the stress, like thing we don't understand, like how that affects business owners who have to, you know. But I think people kind of like, you know, there's so much balance to this thing, because you hear people who are just like, you know, I kind of call it like the mass brigade, but like on both sides, like the people who are just like, you know, they're ready to just ready to draw on core to you if you don't wear a mask. But there's other people who are ready to draw on core to you if you're saying you're anti-patriotic if you don't wear a mask. But I think there's these things in the middle that people lose track of. Like when we look at, you know, when we look at businesses having to close, and we look at these, like we don't understand how much that affects. Like, okay, here's a restaurant that was open, they had to close, they opened back up, they had to bring all their staff back who they told they were going to bring them back, but then they have to close again. And so now you got to go. Then you got and because of how the politics of the things work, with you know, there are choices that could have been made to help ease this, but they weren't made. Like I said, that's a whole nother podcast.
Right.
But just the health and stress of that, of someone who was waiting for their boss to hire him back, then they got hired back, they came back to work, now they got laid off again. That shop owner, he used all of his resources to try to stay afloat during that time. Open back up. Now he's got to close again. That first reopening, he had to call it quits after, like, he doesn't have the resources to go through that again. You know, and I think as we look at, you know, so many things coming up, you know, we look at the rent moratoriums coming to an end. We're looking at, you know, we're just looking at all these things. We're looking at what's probably students coming to an end.
That's in September.
We're looking at all these things, and we're looking at, like, you know, even before COVID came along, all the economists were predicting a crash. Like, we knew there's a crash coming. Right now, it's coming.
Right.
And that's going to be a whole nother thing.
Right, and you look at the CARES Act, which there wasn't, the small business rescue, which we found out later on there were larger corporations that actually received it. When you think about small businesses that opened and had to make all these adjustments for, they actually probably purchased a lot of things to reopen, like the plexiglass, making sure that they had to have masks and hand sanitizer, social distancing, stickers on, there was a lot of things, and I'm sure Alex can speak to that a little bit better than I can, but I mean, just from me as a consumer looking to see what happened, and then people not coming back out either.
Yeah, people not coming back out.
People not even coming back out. They're not really... Your business is not what it used to be because number one, because you can't have that many people, and number two, are you even meeting the amount that you're allowed to have?
Right. I mean, that's all going to take, and again, to speak to how that all comes in a circle, because your mental health affects your physical health. So if your mental health is shot, that affects your physical health. So if your mental health is bad, and you end up running your body down, now you're more inclined to get physically sick. And now, you know what I mean? So it's like, I think people are not understanding this big circle. It's not, I think we need to get out of this camp. We're going to have to get to where there's this holistic look at this whole thing, how it's all affecting the whole, and I just think these next couple of months are going to be really rough. I know things have been rough now, but I think these next few months, Alex, you can speak better to it than anything about just with the stress of trying to keep the business running during this thing, man.
I've been always just sort of keeping up to date with what CDC has put down as guidelines. When most of this situation became as politicized as it did and started splitting up the communities within my own demographic as to how they were going to be interacting with me, all of that started changing. You started seeing a new layer of stress just to get a cup of coffee or just to get a beer, or if I go to my favorite place to get my sandwich and a drink, am I going to be following all of these guidelines, and will the people that are also, the other people going there, also be following these guidelines? How is my favorite place to get my meal and beverage enforcing that? Do we have the right to enforce these things? Then the things that really get to me are how the information seems to be so fuzzy, and you have it just blows my mind how so many people know what's going on in the Hollywood circles, right? But nobody can tell you whether or not the businesses have changed back to now again, say, requiring food with your alcohol purchase, right? Something simple, right? Something they're doing every single day. They know what the Kardashians are up to, but they don't know what, like, whether or not they have to buy, a meal and what constitutes as a meal. The alcoholic beverage control, for example, they're the ones determining, for those of us that have alcohol licenses, what actually counts as, and this is quote from them, a bona fide meal. Bona fide meal. Now we've got those guidelines go up online, and then they're doing a pretty good job of having their agents kind of go out and making sure that, like, if we have any questions, like they've already stopped by here multiple times throughout the closure, reopening, closure kind of yo-yo experience that we've been having. But the bottom line is, what is the real information that needs to be applied? And I have so much respect for what was discussed in tonight's podcast, because really at the end of the day, it's the medical aspect, in my opinion, that needs to be predominant in making business decisions right now. As a small business, I have to think about not only my own safety, but the safety of my employees, and their families and the people that are in their circles.
Mm-hmm.
And then I have to think about how much exposure I'm going to allow, because that's on my shoulders as a retail business owner. How much exposure are my employees going to be given to people who are just coming up and either being disrespectful or like saying I don't care, I'm not going to wear my mask, or I don't care like if I have to be 6 feet away, or we have all of that kind of traffic direction with the tape on the ground and everything, and people aren't even looking at it.
Right.
They just they do what we always did in the past. When you walk up to a crowded bar, it's just like whoever's loudest and whoever's got their hand up, right? They're just crowding the bar still.
Right.
And so really it boils down to like how much authority do I give to my managers to engage with my customers who I value, no matter where they stand on whether or not they think this is some sort of conspiracy, whether they're red or blue, whatever their ethnic background is. All of that stuff is the diversity that I'm accustomed to dealing with as a bartender and as an operator of a lounge. But how much authority do they have to enforce, like what the compliance for these guidelines? Because I am worried about the health and safety of my customers, because that directly affects the health and health and safety of my employees, which directly affects whether or not this business is operational.
Right.
It takes a team, to run something like this, and we're trying to be here for the community, and the community is not being, for the most part, well informed by the leadership, whether that's city or state. We're getting news clips. There's got to be some way to get an official channel of news going on, right? And that's the battle. Like, where do we get our information on a basic level? So here at Brew Bar, we've been serving out of the window, and we've been doing everything. We've evolved 5 different times now in terms of like, how does this business function? From when it first started out, like cleaning, we'd set alarms and go around and clean everything thoroughly, all of the majorly like touched areas, doorknobs and areas. And then we've got then we limited how many people could be in the location, and then it was all of a sudden everything was to go, and so I had to go and purchase just cases and cases of to go items, which is difficult for me because as a business owner, I've been trying to do things, not just keeping an eye on the economical bottom line of running the business, but also the ecological bottom line. We have been trying to be a green business, so all of my to-go cups are compostable. All of our straws are compostable. All of these things that we were trying to do to make an impact, a positive impact in the community, on the planet, in a different way. Now we just slid down the mountain again, because we're creating mountains and mountains of trash, because everything is single use.
Right.
Everything is single use. And from the medical perspective, I've been looking for more direction on how I can be more ecologically conscious and still be, health conscious for service.
Right.
So yeah, it's a battle, and really the major battle for business owners, that I observe in my conversations with other fellow business owners here in Chula Vista on 3rd Avenue, is like, what is most applicable? What's going to be enforced? And at the end of the day, like, who is actually going to be still coming out? So if the information isn't clear for the communities, if the information isn't clear for our customer base, our demographic, then what they're doing is they're creating, like I mentioned at the beginning, a layer of stress, a new sort of communication difficulty, I think, that kind of thing that we all buck at, where somebody's telling you what to do. None of us like it, and none of us have ever gone to a service establishment to be told what to do.
Right.
We come out to eat.
Right.
We're coming out to the bars to talk, to cry into our beer, to have a social and mental health release.
Right.
And now this has become it's become a center of arguments.
Right.
Right.
You know, put on your mask if you're going to use the bathroom. What do you mean? I just want to use the bathroom. What do you mean? I just drank 2 glasses of things that you gave me, and I just want to use the bathroom. And it's 10 feet that way. What's the big deal?
Yeah.
And then I feel like I should be like, okay, do you have 30 minutes? Let me put you in front of a documentary.
Right.
Right. Stuff spreads. You know? So yeah, it's really difficult. And I guess that was. I was trying to be brief, but the more I talk,
no. But that's what it is. I mean, but see, that's the problem. The problem is we don't have time. It's exactly what we don't have time. People are at home. They don't have time. They want answers, but they don't have time to sit down and read the answers.
Right.
They don't have time. They want the information, but they don't have time to read the information. You know, we wanted to, like, I don't know if you guys heard, like, I don't know if you heard about Kelsey Grammer's daughter got stabbed yesterday. Because a guy comes up to the restaurant, people are outside, whatever it was, he didn't meet the criteria of what it is he needed to be served, and he starts going off, and he stabs Kelsey Grammer's daughter and her friend, just because they're sitting outside. Like, he can't get served because he's not meeting the criteria of what he's supposed to do to get served, and he goes off, pulls out a knife, and starts assaulting people. And it's just like you're saying, you know, like, someone's coming up now, they're mad. I'm in the store, I see people getting like such an attitude because they, you know, the lady's like, I'm sorry, you can't come in, like, you have to have your mask on. Well,
but
go
this
to your
is not
car,
new
pull
behavior.
out it's like, go to your car and pull out your little mask out the center dash and come back in here, get your soda and go back out.
It's definitely right, that part. But it's definitely more polarizing.
Yes.
My daughter works in retail, and she called me the other day, and she's like, she doesn't live in the state. She lives down south somewhere. We won't say where. But she is just, I mean, like, the conversations and the way that people talk to people who are serving them, just across the board, has been horrific. But now it's just, people are really stressed out. And, you know, when people are stressed, like, for me, you know, being in healthcare, I don't see people at their best.
Right.
I see people at their worst.
Right.
And so their response and the way that they act may not be the best. But, you know, I'm pretty thick-skinned. But even then, there's a limit.
Right.
There's a stop. I mean, do you think they passed a law against assaulting a healthcare worker for no reason?
Right.
There's a reason for that.
Yeah.
So, you know, it's just difficult. It's just, wouldn't it just be nice if we could all just do the right thing?
Can't we all just get
Can
along?
we all just get along? Can we all just get along and put our mask on and wash our hands?
Well, look, you know what? I think on that note, we'll probably bring this to a close. Samantha, is there anything right now, any points that you would like I said, because I'm gonna have you come back in a brief time, because like I said, this thing moves so quickly.
It is
and it
moving
changes
so quickly.
fast. And I really, you know, like we were talking about the things that we had to step back. You know, when this whole thing started, you know, I got laid off. I got laid off at Intercom, which is what was part of the reason the podcast came to a halt. I got laid off, and you know, I have been on the air at Intercoms. I have been at that station since 2005.
Wow.
So that was 15 years. I
Wow.
had one radio station.
Oh my
15
goodness.
years. And the crazy part about it is that, you know, I was doing the podcast on my own. They came and asked me, hey, why don't you go ahead and do the podcast with the station? This, that. Like, you use the studio, blah, blah, blah. It was a win-win for me. Okay, good, let's do it. I have finally got to a point to where I went from night to daytime. Now I have a morning smooth jazz show. I'm a morning host. Everything's going along now. Everything that I want to do myself, that I always wanted to do, now on Saturdays I have my own neo soul class jazz show that I was doing. I was playing the music I wanted to play. I was like, yeah, I'm okay. I finally got there. This happened. Got furloughed. Going to furlough you. Gonna bring you back in a couple weeks. And I finally got laid off. And then once everything went on lockdown, it was like everybody was online. Everybody was online because everyone was forced to be online. So now all the sports shows are done in Zoom style, and everyone's having meetings on Zoom. And I just was like, I just couldn't jump out there like that. I was like, I've been doing what I do for so long, and now everybody's doing it. And I was just like, I had to take a break, and I just had to recalibrate. And it was Eric. It was Eric who was making me get back into this space. It was Eric who was always texting me like, dude, when are you going to do a podcast again? You got at me and was like, hey, when are you going to do a podcast again?
Yo, what's up? Where you at? What's happening? I was I got to call him. I was like, I know he's like doing something. I was like, we got to talk about this because you're right. Everybody's talking about it. But I feel like now was a good time to have this conversation because like we've gone through this influx, like Alex was saying, you've had all this movement. You know, we've had all these other things happen in our community and in our world, and it's just like, now's a good time. Yeah. And I think that this is the time because they're talking about a second wave.
Yeah, exactly.
They're talking about a second wave. And I think that we need to have these conversations just so these things stay fresh, but it's not just, it's also the forum, the delivery of it. Because, you know, you have forums all the time where people talking lots of numbers. But, you know, numbers are great, but how is that affecting people's lives? They want to know
context
how.
Behind it.
Yeah, it has to have contextual purpose for people to really get into it. And, you know, just having a conversation about it, I mean, I feel better. I don't know about anybody else.
You know what? That's why I always started the podcast like I did. Even when I started this one back up, I was like, okay, I'm going to change it up a little bit. I'm going to do some episodes by myself. I'm going to talk about news. I'm going to talk about this. And then it was like, dude, that's not what you do. You talk to people. What you do is you talk to people because you want people to talk, because you got to have a conversation to understand. You have to be able to take the time to understand. You have to be able to sit down face to face to talk to people, to get the inflection, to get the ideas, to understand. You have to have the conversation, because we live in the world of Twitter, 280 characters, and people are just firing at each other all day.
And you know what? When you were saying that right there, I think that that's the most important thing on all issues. People don't talk about it. They just make their statement.
That's it.
They make their statement. They make their stand, period, in the discussion. They don't try to see the other side of the conversation. Mm-hmm. And people have a hard time having dialogue. Not a screaming match. Mm-hmm. Not a defiancy, but like one-on-one, understanding what the other person is feeling, what the other person is going through. You don't want to wear your mask. Tell me why. Mm-hmm. Let me tell you why I want to wear my mask. Let's come to, and you may not change that person's mind. You may agree to disagree, but there's been a dialogue. Mm-hmm. There's been some understanding. And I feel like that's the most important thing that we need to focus on right now as we start moving into this next shift, and people are suffering, people are hurting, people are struggling, people are losing their loved ones, people are not able to bury their loved ones the way that they want to. I mean, there's a lot of pain going on right now, but there's also a lot of good. There's also a lot of good going on. We have people that are listening who never listened before. We have people standing up for a group of people. I have to there's so many people in this community that do great work every day, that have always been doing great work. I feel like I need to say something about a couple people.
Yeah, do it.
Dr. Rodney Hood with the Multicultural Health Foundation. He helped organize the task force. Dr. Susan Afalo, Dr. Robert Gillespie. Those are just some of the people, and particularly in Southeast San Diego, and a host of others that work with them, and different organizers and different organizations that truly dedicate themselves. People who have conversations like you, who invite me to just talk about things as it relates to this. Business owners like Alex, who care about the people that work for him, the people that come into his establishment. We just have to care, and we need to act on that caring. That's what we need to do. Mm-hmm. I mean, it's, after the George Floyd was murdered, and Black Lives Matter, and people started having these real conversations. We started getting all these donations. And at first I was like, I felt a little way about it. I was like, I don't know how I feel about this. But then at the end of the day, for an organization that's been in the community for over 40 years, serving people, doing blood pressures, being, one of the first organizations that did the flu shots, we helped with the hepatitis outbreak, nurses that live in your community. I was like, okay. But it's all of us. We're one village, and without one aspect of people really understanding, we have to work harder to do better.
I was just thinking, listening to you guys mention about the need for more conversation, right? The need for more connection, and I just can't help to think how interesting it is that we have found ourselves in a pandemic that seems to be shining the brightest light on all of the messed up communication that we've had as a society. And that we've been just coping with it because we haven't been trying to solve it. Well, I'm sure there's been some who have been trying to organize and fix some of the issues that we've got in our news system, in our health system, in our education system, in our civic systems, right? Those conversations always seem to be happening, and they were usually happening on the radio, or they were happening in articles in a magazine that had too many words and not enough pictures. Right. The thing is, it's so interesting because now we are all supposed to be home, which means we have, it doesn't necessarily mean that we have more time, but it just means that we have more, maybe, opportunities to manage our time in different ways, where now we can allocate time to research, to listen, to things that are being published online, that are coming through the airways, that are coming through whatever it is that we're using to try and educate ourselves in order to be a part of this conversation. Because now that's the thing that's happening, right? With the BLM movement that happened, as somebody who was surrounded with all kinds of reasons to participate emphatically in that, to be a part, to pick us, to draw the line in the sand. I had to do research. I can't just be like high-fiving everybody that's coming by, hey, I'm with you, right? What does that mean, right? I have to get in. I have to know why. Why do I want to participate? Why do I feel affected? And to try and shake off some of that fear that we were talking about earlier. It's just a question. And I think that, I don't know if it happened to you, but when I got out of high school and I went into college, and then I left college to just get right into the service industry because I knew it was the career for me. I always had this residual, if I could only go back and just do an exit interview with the educational systems that I participated in. And I said, I was thinking to myself, if we just made debate, for example, a mandatory thing, then we would maybe
not just a special club, right?
For the air quote nerds.
Yeah, right. If we made debate a thing and didn't just use broad terms in order to get in order to be able to pack in a bunch of information into a space. When you talk about a communications class, what the heck is that even mean? Right. It's what we're all doing every day at every class. Right. But if you go into a debate and you learn about establishing your reasons for taking a position and then having that discussion, all of a sudden maybe you start solving so many of the future arguments that are just arguments of people yelling at each other. Or like you were saying, just firing off words, right? Because they're everybody wants the mic drop moment. Right. But nobody has, but I feel like when you start getting into a lot of conversations now, and even when I was just getting in the service industry. And like you mentioned, in the healthcare world, you don't see people at their best. So what kind of forms of communication do we sort of default to when we're under stress, when we're angry, when we're disappointed, when we're dismayed, right? And how can we communicate clearly still, because the clear communication seems to always be the way to solve anything between anybody, no matter where you came from or where you are. And so like I always do, I do lament things like that. Like in school, maybe if we could talk more about economics, like as a mandatory, right? And talk more about debate and learn about vocabulary. Let's figure out what are our rights and what are the laws that apply to us, and have a civic sort of immersion course. Things like this that like that I always felt were absent from our educational system, and I thought like, wow, how come? And then the first thing that happens is we get all these problems that are happening, right? We have the social unrest now, and the medical misinformation all over the place, and the politicizing of it, and what ends up happening is, the first thing everybody goes is, you know what we really need? We need some more education. We just need some more education, and then it's just like it's just this trickle down, like almost like a need for reform on all of these levels, because I heard you mention earlier we don't have any attention span anymore. No. To have.
So going into that,
yeah,
just the most important thing is that people don't know how to listen anymore. They don't listen. They hear the words that are coming out of your mouth, but they're not listening. They're formulating their reply, what they're going to say, how they're going to fight, how they're going to argue, they have these it's almost like they have these talking points set up, ready to go, that they just spew right back at you, no matter what you say. And I think listening is a skill that you learn in debating, because you have to wait your turn. Wait your turn. No interruptions. You wait until that person has finished their thought. And then if you want to reply, then you have to be able to be listening to what they're saying in order to mount a reply. But people don't know how to listen anymore. They don't listen.
You know, one of my favorite podcasts I did with the guy, I gotta have it back, is with a guy named Michael Oriston. He was running for the 53rd congressional seat, and this got vacated, so a lot of people were running. And Mike he's funny, because if you look at it, if you go to his website and you look at him like just on the surface level, right? He's a Trump guy, he's a Republican, he's a guy who has money. And I remember his campaign manager had reached out to me. It was like, hey, my guy wants to come on your podcast. And I was like, I went to his website, because I have people on my podcast that I'm interested in. Like, I don't just have it to have it. Like, I'm just going to bring you on just to bring you on. Like, why? And I literally was like, why does he want to be on my podcast? Like he doesn't sound like anyone who would want to talk to me. And like, I went to his website and I watched a couple of his videos, and I told people on my job, like, yeah, man, he's going to come on my podcast. And like, I work in theater, like I work in a real liberal, industry. And like, most of the people are like, oh man, I can't wait for you to have him on, because I know you're going to go at him. You're going to ask him this, that. I'm like, well, yeah, okay, whatever. And I actually had one of my coworkers got mad at me, like was literally going at me because I was going to have this guy come on my podcast. Well, I don't think you should give anyone a platform like that. And I was like, well, I just want to talk to the dude. Like, it's so funny because we had the greatest conversation, and it was like our conversation went from everywhere, from like his love for surfing. This guy was like on the jazz scene in San Francisco, so we were talking about jazz music and we were talking about all this stuff. We would dip into the political side. Of course, there was stuff that I didn't agree with him, he didn't agree with me, but it never got like contentious because we had a conversation. And like, we were listening and talking to each other like about life and like how our views came from our life. And like, literally in that conversation we had, like, the points where we differed were like, once you got into the conversation, they were like, not that they were minuscule, but they were small in the aspect of like, for like almost 2.5 hours we talked, and like you would have to find those parts where we differed. Like you would have to really go in and find in that conversation where we differed on this like policy, or we differed on this, or we differed on this about the environment. But like he was one of my favorite people to ever talk to. You know what I mean? And like if you listen to the podcast, he'd be like, yeah, I don't like that dude, what he said about that, but I get why he thinks like that. And like I don't have to vote for him. I don't have to agree with him, but you know what? That dude's a human like me. You know what I mean?
You just took the words right out of my mouth. I was just going to say, it humanized him. He's human. He has kids. He has someone who loves him. He has a family.
Yeah, he gave me a CD.
We all
Like,
have
I'm
that.
going to listen to my
It's
CD.
like,
Check it out.
It's
I'm
like, that's
yeah.
somebody's son. That's somebody's uncle. You know, like, it's...
Exactly.
You know, it's not like he wakes up and, you know, is like, "Arr," you know,
Yeah,
like some bad dude that's just
exactly.
walking down the street. I mean, there are those people, but for the most part, we have more in common than we have that's different.
Exactly.
More.
Exactly. And he knew it. Like at the end of the day, he knew. Like, yeah, I'm like, yeah, dude. You know, I'd never vote for you, right? But I'll sit down and have a beer with you anytime. Like, we can sit down and kick it anytime. You know what I mean? Like, so I mean, and so that's why, you know, that's why, like I said, I'm glad you were like you're the first guest back on my new podcast. Like, I so appreciate it because I think not only it's just timely. You know, and I think it was at this time, like we were saying, like, you know, people are just going at each other right now behind this thing. And it's like, that's the last thing we need to be doing right now. Right now, we need to be figuring this out because this is going to get worse before it gets better all around right now. Like, health-wise, economically, this is about to get, like, not only just like you said, like, flu season's on the way, this crash is coming, like, people need to figure out a way, like, if you've ever dig deep, like, you're going to have to dig deeper now. If you've ever had to get your mind together and dig deep and find creative ways to do things, you have to dig deeper now. And you're not going to go dig deeper out of fear. You're not going to go dig deeper out of confusion. You're going to have to find some way to even your keel and talk to people and figure it out, because as a country, and then we're not even, like,
we have the elections coming up.
Even though it's like right in front of our face, and it's like the biggest thing in front of our face every day, you're almost forgetting that, like, oh, damn, in 100 days I got to vote for the president. And I got to vote for Congress.
That's bad enough in itself. Without all these things that are going on, how bad it gets in our country when in a presidential election, no matter which side of the aisle you land on, people get inundated. They are just so tired, and it's just, whew.
So like that, you know, that's why I said, like, I'm glad to, you know, like, I just felt like I was like, yeah, it's time for the conversation. Like, everyone has to do their part, right? This is my part. This is what I do.
Yes.
You know what I mean? This is what I do.
Everybody
I try to bring people
role.
together for conversation. So I'm like, well, you know what? I'm gonna do my part. I'm gonna try to, you know, bring people on to have information that people need to hear, you know, and really get it out. Because like I said, I know you do new stuff, but that new stuff is hard. Like, I've had to go in there, KUSI, these other places in the morning. Like I said, it's rushed. It's in there. Okay, where you at? Just wait. Okay, come on. Okay, what do you got? What's your name again? And who are you with? And what's the website? Okay, thank you. You know what I mean? Yeah, got okay, cut. Thanks. All right, give me the microphone back. Let's go. And you're just like, did I do anything? Did I tell anybody anything in this 5 minutes I was on with that person?
You humanized me. I'm human again.
So I'm gonna throw if anyone's listening, like on Spotify or Google Podcasts or whatever, go to ahmedsvoice.com. I'll have all the links that Samantha talked about. I'll have all the links for you to be able to go on and click and check out. And like, was one of the most important things that she said, and that's why sometimes it takes me a long time to formulate things, is because you have to take the time to read. Like, you have to take, like, I remember when this first started, one of the first places I did, I was like, okay, how can I figure out what's really going on? One of my first websites that I bookmarked was the John Hopkins map. Like, that was the first thing. I was like, okay, I know John Hopkins has the real deal on the race. So like that was one of my bookmarks, and like I would share it to people. Like I was like, hey, okay, this is what you should be looking at every day. Like they got the real deal on the numbers, the rates, and this that. But then also as we talked about everything was bad, I always try to get people to understand like, but also watch the recovery rates. Don't just look at the bad. Look at the recovery rates also. Look at who's recovering. Look at this, that. So, everyone, look at the links. Read the info. Take the time. It's so important right now. It's the most important thing you do. You think you're wasting your time. You're not. Take the time so when you get in these conversations, you know what you're talking about. You're not slicing somebody up on your Facebook feed every day. Your Twitter feed. Get out of the battle mode. Start sharing information a little bit more.
Turn the TV off.
Turn the TV off.
Get off Facebook for a day or two. Get off Twitter, Instagram, unless you're posting pictures of like a flower or your dog, Post something other than about COVID. There was days, I think there was a period of weeks, I absolutely refused to post anything about COVID-19.
Yeah.
And I had people in my messenger just asking me 1,000 questions. I just absolutely refused to address it. Because there is so much going on. I was like, I cannot be another voice. Right. I just cannot. There's plenty of great sites out there. I would tell them where to go. I used to send people this great video explaining what COVID-19 was when it first came out. But that was as far as I would go if they asked me. Because you just got to unplug too. Yeah. There's a time and a place for everything.
Exactly. Samantha, thank you.
Thank you so much for having me here.
I'm going to have you back soon so we can keep people educated on what's going on with all this.
Yes.
Alex, sir, thank you for opening up the Brew Bar to the Ahmed's Voice podcast. 277 3rd Avenue, y'all.
Chula Vista.
Get down here, check my man out. I'm telling you, man, like, look, get some of his coffee, get one of his alcoholic concoctions with the coffee. You won't be disappointed. I'm telling you right now. Just talking to a coffee guy, I'm just saying.
Non-coffee drinkers can come to. Makes a mean tea.
If you like the smell of coffee like Samantha, come on down here. You'll smell some good coffee. But you guys, again, thank you. I appreciate it. And everybody, we'll talk to y'all again soon. Man, that's a wrap, y'all. You've been listening to the Ahmed's Voice podcast with my special guest, Samantha Gambles Farr. She is the president of the San Diego Black Nurses Association. Make sure you visit ahmedsvoice.com for more information regarding links that were discussed here on this podcast. Also, make sure you visit Brew Bar 277 3rd Avenue in Chula Vista, open now for outdoor dining and for pickup. Again, thank you to Alex for allowing us to step into the Brew Bar and record every week from inside the venue. Coming up on my next episode, I'll be talking to Mr. Corey Briggs. Corey Briggs is running for San Diego City Attorney. He will be in a runoff coming up on November 3rd. We'll have a great conversation about what's going on with that election. In this election cycle, we'll also be talking about the state of electronic surveillance in San Diego. Again, for more episodes of the Ahmed's Voice podcast, the More Than a Voice podcast, visit ahmedsvoice.com. Don't forget to give me a follow at Ahmed's Voice on Facebook, Instagram, and Twitter. I'll talk to you again next time.